Namaskar, good evening to all of you. On the occasion of World Mental Health Week, on the sixth day, we have a very special international guest speaker with us, Honorable Dr. Barry Rathner, sir. He is a Homa psychotherapist, also Agnihotra expert and scientist at Eco Village Brgu Aranya, Poland. And today's topic is very interesting and very unique. That is mental health and spiritual health are.
Okay, so uh, uh, actually, I've been thinking about this quite a while, and I think I have two or three titles. Of course, the theme for the uh, week or 10 days is mental health and self-actualization. And that gives me leeway to talk about several topics. So first, I'd like to speak about pollution. And because the problem of pollution is what it is, and it was not good before the pandemic, uh, we might wonder if human conditions have been made worse by the worst form of pollution, which is thought pollution, people's thoughts. And all of us have experienced and certainly heard about the worry and the stress and the anxiety that has become endemic during this pandemic. It's a problem. It seems that many studies have shown that mental disturbance, substance abuse, domestic violence, and even suicide rates have increased exponentially. And all of this may be a prime current example of the atmosphere having been poisoned and how it affects all of us. Now, I'm not going to be put into the category of a doomsday sayer or doomsayer, because I'm not going to talk only about the problem. I'm going to talk about ways out of the problems, ways to fix it. And I'll give you a hint that this concept of atmosphere, since I teach Agnihotra and homotherapy, we have a saying that goes like this. Agnihotra heals the atmosphere, and the healed atmosphere heals us humans as well as other life forms. And to be clear, those of you who may be new to hearing me, or Ulrich Burke, who spoke, I think, 2 or 3 days ago, the Agnihotra of which we speak is a 10-minute yajna, or fire, or homa, that is done in a small copper pyramid at the exact second, the exact moment of sunrise and sunset. We're not talking about other uses of the word Agnihotra in some countries, especially India. We're talking about this one yajna, and that is the one for which we have much data. Experiments have been done, and I have the personal experience of having been doing it for more than 40 years. But as I've said before, please do not believe what I say. Verify and examine yourself. And that you can do by beginning a 2-week trial of daily sunrise, sunset Agnihotra. Each one takes about 10 minutes. And this will give you the firsthand experience of the uniqueness of what is involved. It's that simple. When I began doing it, I was kind of taken aback, even shocked by the simplicity of this whole thing. I knew what I was experiencing: improved sleep, levels of serenity I had not experienced maybe ever, and many more things. And then I said to myself, Am I supposed to believe that this 10-minute fire burning cow dung, cow's ghee, and brown rice and saying this short mantra is responsible for these effects? Well, I hadn't changed anything else in my life, so I had only become 2 weeks older, maybe 2 weeks wiser. That's up for discussion. But I made the segue. I saw the connection. Now, as compared to 40 years ago, we have a lot of data, as I said, about the effectiveness of Agnihotra. And one such possibly breaking trial was completed about a month ago in Baltimore, Maryland, USA, by one gentleman, Gautam Bodh Pudi, an Indian American, and he's also making an Agnihotra documentary about all around the world what's going on. But this trial done in Baltimore, in conjunction with Dr. Henry Gregory, a longtime Agnihotra practitioner and a therapist, found results that are hard to believe as far as stress relief from a control group versus an Agnihotra group. And I may get back to that in a while. But now I'd like to look at two major diseases, if you will, in the mental health spectrum that are currently exploding since the pandemic began. One is depression, the other is addiction. Now, I wanted to say first about addiction. Addiction, of course, refers to people who have a substance abuse problem. But some of the crocodiles, if you will, that I will refer to later, that keep us from experience the serenity and engaging in self-actualization, make all of us addicts, all human beings, to some extent or another. Those crocodiles, for example, jealousy, anger, pride, attachment, lust. If any of those things bother you, you might say you either are addicted to them or at least you have trouble controlling them. Some of us have trouble controlling anger. Some of us have trouble controlling attachment to people, attachment to objects, attachment to money. So this pertains to all of us. Now, to the extent that we are aware if some external triggers have brought on the onset of depression or addiction, there are interventions and tools that may be helpful. If we look deeper, it seems that our ability to cope and adapt to the triggers, a trigger being a life event that may propel us into a depression. Sometimes it can be the death of a loved one, a divorce, such things. The extent that you and I have self-actualized and realized at a slightly higher level what's going on, that is likely to be the extent that I can assuage or lessen the effects of depression and be less troubled by addictive behaviors. What I mean by what I said is, why is one person affected by an event very slightly and another person affected so much so that they become severely depressed? Well, we might hypothesize that this has to do with how much one person has self-actualized or self-developed as compared to the other one. Because I have learned and found it to be true, though I still have some ways to go, that external events don't control us. We have the potential to control them, not whether they happen or not, but how we react. And some of you might have heard me say before a rather famous quotation, which I think became a book title based on this, something to the effect that what happens to us in life is 5% the event and 95% how we react to the event. And the nice thing about that is we can control how we react. Karmically, of course, whether the event occurs in the first place or not is part of the equation. But we won't talk about that at the moment. In psychotherapy, people often tell me about what's going on with them. And I've come to the conclusion that often we humans don't know why we feel a particular way at particular times. Some people don't even know what they feel. And there's a brilliant book title that's something like, If You Can Feel It, You Can Heal It. And men especially, as compared to women, have difficulty feeling. Well, during this pandemic, which, as we all know, is a truly unprecedented occurrence in our lifetimes, unless you're over the age of 102, when the Spanish flu epidemic came in 1918. Well, we see that mental health problems are going through the roof. And these are not the days for us to slide, to rest on our laurels. These are the days to be on our game, thinking, willing, and feeling optimally, basically being the best that we can be. Others need it, we need it, the planet needs it. And that's one reason I'm excited about sharing Agnihotra, because you're not just helping yourself, you're helping other people, especially those anywhere within a 1.5 kilometer diameter from where you're doing the fire. And it helps gardens, and it helps animals, and it helps the planet. How is this connected with self-image or self-esteem? Well, as Samyak mentioned, another part of my title is mental health and spiritual health are the same. Now, why do I say that? Number one, this has been my experience. And number two, I was taught 45 years ago that the spiritual and the material are the same. It's just how our minds look at it. And mental health may be considered a material manifestation, in part because how healthy we are from a mental standpoint depends on material actions we take, what foods we eat, how well we sleep, how consciously we brush our teeth, etc. An example of a connection between, let's say, brushing our teeth and mental health is, did you know that often when patients are admitted to mental hospitals, at least in the United States, the first thing virtually that is done is their teeth are examined. True story. I don't know all the details of how and why, but I do know that there is a connection. Uh, so, next, I wanted to talk about one of the 6 crocodiles I mentioned, because again, until we make progress in lessening the effects of these on us, we're going to have difficulty self-actualizing. Attachments. Attachments are not good because we get stuck in them. It can be a romantic relationship. It can be an obsession with cleaning our houses. It can be how attached we are to how much we weigh, how much we look, how we look. And it can be attachment to objects and certainly money. In 1932 or 33, I think, during the depression in the United States, when people lost their money, they started jumping off of buildings, killing themselves. It may be more complex than I'm about to say, but the many farmers in Maharashtra who committed suicide over the last 10 years, in part, I would hypothesize, has to do with not being in touch with their real selves, hence what is really important. If they were, they would see that losing their farms, losing their money, as difficult as that is not, should not be an external factor leading to them committing suicide. Now, humility is said to be an important aspect of self-actualization. And this is something that can become a little confusing when talking about mental health. Many people troubled by depression and addiction do not have good self-images. Their self-esteem is quite low. If it's true that this definition of humility, which is not thinking less of or on yourself, but thinking of yourself less, that should give us some insight into how humility is not anathema, does not go against mental health and self-esteem, but in fact helps it. If we're constantly thinking about ourselves, obsessing on and basically putting our own development or evolution above nearly everything else, what's going on? What's going on is a diversion of attention from where it does the most good. To cite an extreme example, an extreme in the sense that Mother Teresa's behavior raised the bar, we might say. Do any of us really think that either during the day or at night, when she was assessing the day, if she was, that she stopped to measure what she had done with the lepers in Calcutta that day and how they might have contributed to her self-actualization? I doubt it. So, if we can become less self-absorbed by trusting that if you put one foot in front of the other, you will ultimately get to your destination, that sounds as an example of faith would be a good thing. Now, That doesn't mean, by the way, if you're not going to obsess on yourself, it doesn't mean you can't take time to do swadhyaya. Swadhyaya being the fifth step of the fivefold path of Satyadharma, of which the first step is yajna, Agnihotra, the second dan, the third tapa, the fourth karma, and the fifth swadhyaya. So trying to answer the question, why am I here? What is my specific allotted task? It's good to take time to do that, but not to do it so much that you end up in therapy 5 hours a day, every day. There's an equation that I'd like all of you to think about. It's so simple, it has only 3 words, and it is that devotion is service divided by ego. Devotion is service divided by ego. What is devotion, you may be wondering? Well, if you look at it as in a definition, you can say love, loyalty, or enthusiasm, like that. It is not attempts at personal aggrandizement to make yourself famous, to gratify your ego, to fulfill your desires. If devotion to our higher selves is sought, it sounds a bit more appealing. If your goal is name and fame, attracting others, either romantically or as disciples or as customers, and money and such, we may be building castles in the sand, which is especially risky when, because of climate change, the seas are rising. Castles in the sand may be short-lived. We haven't talked much about love. We talked about service, devotion. You know, if you want to simplify your life, then keep in mind the famous quotation, love thy neighbor as thyself. Love thy neighbor as thyself. Even if your neighbor engages in activities that are not karmically sound. Now, material and spiritual being the same. We talked about the crocodiles. By the way, 2 good websites to find out more about homotherapy, Agnihotra. One is homotherapy.org, and another is agnihotra.pl. PL stands for Poland, and that is where I am at the moment because that's where I live, at Eco Village Bruguaranya, a teaching center for homotherapy. And the websites will talk about Agnihotra from many different standpoints. In psychology, perspective is very important. Now, there's the obvious example of perspective. Is my glass half full of water or half empty? Should my love and acceptance of another not bear on his or her actions? Is this person half full or half empty? Erik Erikson, a famous psychologist, wrote about Mahatma Gandhi and said the following: to seek immortality and glory through killing or being killed in the heroic defense of a territory or world image or an idea deemed in mortal danger comes down to whether you're willing to risk your soul at the risk of losing one's life and extending even to your enemy the faith of human love. So again, is the glass half full or half empty, and such. I don't have too much more time. So I think I will just review a couple concepts, and then if there are any questions, if there's a chat, you could type it, or perhaps Samyak can open your mics and you can ask them. But the bottom line is, any question that can be asked, the answer is love. If we can train our minds to react with love under all circumstances, not only will we be happier, but we will have self-actualized or evolved to a very high status. How is Agnihotra connected to this? Well, doing what I just said was never easy. It may be simple, but not easy. And in today's world, it is harder than it may have ever been, at least since 1918, because the pandemic has created stress, anxiety, addiction, and it affects all of us. So training our minds to react with love is easier said than done. And if you have any interest in following the news, you can see that the state of the world today hardly exemplifies loving thy neighbor as thyself, hardly exemplifies training minds to react with love under all circumstances. So, what to do about it? I do Agnihotra. I don't tell all of my clients in psychotherapy to do it, but I probably tell most of them that I do it. And it helps my mind, it helps with my old addictions, and it helps with my depression when it rears its ugly head. And as difficult as that is to believe, again, that a 10-minute fire at sunrise and sunset can do that, try it. It's not part of a religion. You can do it and not have faith in it, and it will still be effective. It's different, in my experience, than other forms of meditation. You can meditate or you cannot meditate when you do it. It's up to you. In fact, to be technical, as soon as you say the mantra and make the two offerings to the fire, you're finished. Agnaye swaha, agnaye idam namama, prajapataye swaha, prajapataye idam namama. That's how long Agnihotra takes from a certain standpoint. Of course, there's the 5 minutes of setting up the fire. But if your telephone rings, if your baby's crying, as soon as you've said that mantra, put in the 2 offerings of rice and ghee, technically you're finished. It's nice to be able to sit for some moments and try to meditate, but it's not required. And I would encourage you to believe what you experience. If what I've said and what you can read on those 2 websites you find interesting enough to try it, then we can talk after that. Thank you. Namaste.
On this occasion, on World Mental Health Week, what will be your advice or message to the mental health professionals? How they can introduce Agnihotra as psychotherapy uh, in the treatment process of the patients? So, what will be your advice to the mental health professional? How they can implement it?
There are basically 3 ways you can do it. The best way is if your client is open to doing something like Agnihotra, then you can encourage him or her to start doing Agnihotra, at least for a 2-week trial. The second best option would be doing Agnihotra in the venue where you do the therapy. Not only will you find the therapy becomes easier and more effective, but it's like giving your clients a dose of Agnihotra, because if you go into a house where Agnihotra has been done, for any length of time, you can feel the difference, and your clients would feel the difference consciously or not. And what is the third? Well, the third is simply if the therapist does Agnihotra, then he or she becomes better able to help his or her client. So, one thing in therapy we find, it's said that many human beings have a self-sabotage gene, if you will, that we don't always do what's best for ourselves. And in fact, often we do what's hurting ourselves. I know one lady, for example, whom I met 4 or 5 years ago, who said she had been doing Agnihotra for 6 months and she stopped it. And I said, why? And she said, I was fully aware of what it was doing for me, but I wanted to try to do it on my own without the external help. Well, I haven't heard anybody else say that. It might be a mentality similar to those who like to go mountain climbing or do other difficult things. But again, in today's pandemic ravaged world, I would take the easy way out. And doing Agnihotra is, in my experience, the most effective and easy way out.
When we talk about the mental health professionals, they are a very great responsibility for dealing with the mental health of others. So, what will be your message and advice again to the mental health professionals that, or we can say, what are the qualities of an ideal or a good mental health professional, in your opinion?
Empathy is at or near the top of the list. If the therapist can put him or herself in the shoes of the client or patient who has come then answers may come. To some extent, that's a function of ego. And remember what we said earlier, devotion equals service divided by ego. The higher the ego, mathematically speaking, the less devotion. So the therapist should try not to be egotistical, should try not to think that, because they've been more educated, because they may not have an addiction problem, whereas their client might, yes, have an addiction problem, that they're somehow better. So there's no substitute for evolving. And I've heard it said by a source that I've never found to be wrong, actually, that one innate problem with psychotherapy is the client can only rise as high as the therapist. The client can only rise as high as the therapist. So not only should the clients choose carefully, but the therapist should remember that their job is to continually improve, evolve, self-actualize, and that's how they become better therapists. I hope that's a kind of a short answer, Samya.
Uh, we heard a lot during this session also, and I also mentioned the theme that mental health care for self-actualization. And in various theories of psychology, we have also heard the highest potential of human being is to attain self-actualization. So, in your opinion, in your experience, what are the ways or the techniques for humanity or individual person who wants to be self-actualized or who is trying to moving on the path of self-actualization? So, what will be your advice to that person, even they are therapists or common people or anyone who wants to be self-actualized? So what will be your advice or what is the process for it?
The short answer is 5 words. Yajna, dana, tapa, karma, swadhyaya. Uh, why do I say that? Because that's been my experience and the experience of many of my clients and other people around me. We do yajna to heal the atmosphere. We do dan to help us with attachments to material things. We do tapa, self-discipline, because most of us need it. Most of us need it. None of us have habits, or none of us do not have habits that would be better off being improved upon. Eating too much, sleeping too much, getting angry, and such. Self-discipline helps with that. It kind of burns out the samskara, the old impressions on the mind. So, tapa. Karma. Without an understanding and an appreciation of the law of karma, we become kind of like hamsters going around their little wheels. If we're aware that there are basically 3 kinds of karma, karma, good actions, akarma, bad actions, vikarma, the specific allotted task that each of us has in this lifetime, in order to evolve, by the way. You can evolve as a carpenter, worked for Jesus. You can evolve as a plumber. You can evolve as a mother, because the spiritual path does not mean necessarily doing pujas, sitting in the temple, going to Himalayas and meditating for a few months. The spiritual path can be changing the diaper of your baby, washing your dishes. It depends on how you look at it and how you approach it. If you do it as service, you can say service to your God if you want. Whatever it is, if you do it as service with as least amount of ego as possible, it helps your self-actualization. And then, as we said earlier, swadhyaya, self-study, which is a 24-hour job, we can always assess where we're at, where we're going, where we've been. And that is one, perhaps the most directly connected of the fivefold path to self-actualization. Although, again, to be simple, doing Agnihotra to some extent involves all the other 4 steps. But doing Agnihotra has the effect on the mind, which is the organ, if you will, that thinks, feels, and wills. And Agnihotra attracts and balances prana. And prana and mind are like 2 sides of the same coin. So we have to renew our minds, train our minds to react with love. So I urge you to do this 2-week trial. If you're already doing Agnihotra, by the way, there are some things you can do to amplify, to increase the effects. One is doing another yajna, Om Trambakam yajna, which we do for 5 hours a day at the Eco Village, Rugararanya, where I live. Not one person doing 5 hours. It's usually like, sometimes it's 8 people doing 40 minutes each or whatever. But for yourself, if you're having a particularly difficult day, or you anticipate having a particularly difficult day, 30 to 60 minutes of Om Trambakam, which you can see how to do in some videos on homotherapy.org, I think. But basically is similar to Agnihotra. You do not use rice, however. It uses only cow dung and ghee. And one major difference is, unlike Agnihotra, where you say the mantra once, Om Trambakam, you have to keep saying it over and over and over. So your fire's going, and you're saying Om Trambakaya Jamahe Sugandim Pushti Vardhanam Urvarukamiva Bandhanan Mrityor Mukshya Mamritat Swaha. After you say Swaha, you put a drop of ghee into the fire, and then you say it again, Om Trambakaya, etc., etc. And if you'd like to visit sometime, very interesting place in India, in northern Maharashtra, there's a place called Tapawan. And there, that mantra and that fire has been going on nonstop, 24 hours a day, every day for 20 years, 20 and a half years, 20 and a half years. So, of course, Agnihotra is done also, but that is someplace you might want to visit, and we can let you know how to get there. Or you can Google Tapavan, but try to come up with the center in Maharashtra. There are other Tapawans in other places.
Uh, One very eternal question, and it is in every human's mind, but they are wandering here and there to find out its answer. So I am putting this question in front of you, that what is the purpose of human life? How you can tell with your vast experience in this field. So kindly provide some light on this question, that what is the purpose of human life?
In 10 words or less, yes? uh, you know, one way of looking at it is in terms of self-actualization. You know, from a Vedic standpoint, you might say that the purpose of our lives here is to finish up all the accumulated karma that we have, so that when we leave the body, we don't have to come back again. Now, accumulated karma, of course, means akarma, bad things. If we've done bad things, we have to stick around and pay it back. Life to life to life to life. What about good karma? Well, being non-attached to good karma is important, because good karma can require us to be reborn into another life in order to reap the rewards of this good karma we've done with attachment. Okay? That's the golden chain. The bad karma is the steel chain, but they're both chains. So, living our lives in consonance with divine will, or in 12-step programs, as they say, giving over our desires to higher power and trying to live life as we would think a God would lead it. Many people would say that's the purpose of life. And, you know, you can say it might help me not have to be reborn, but it will also help me be happy here and now. And being happy here and now, I think, is one clue that you're doing the right thing. It doesn't mean you won't suffer illness or have to give dakshina, but the perspective, your mind, will be trained. And that is one definition of happiness and one definition of purpose.
Thanks a lot, sir, for your valuable time and presentation on a very unique and important topic. So, with your permission, now I would like to wind up our today's session. So, with the Mahamrityunjay mantra from your side, I would like to end today's session with your permission.
Okay. Uh, Let me just say one thing first about that mantra. Uh, the word uvarukamiva, bandhanan, mrityor, mukshiyamamritat swaha. Uvarukamiva means cucumber. It means cucumber. So how does cucumber, in Sanskrit, how does cucumber get into this mantra? Well, we just spoke about when we leave the body, that our soul can go on to the next level of existence, and we would not be required to come back in a body again. And that's what that mantra speaks to, that our soul should leave our bodies at the correct time, just as a cucumber falls from the vine to the ground at the proper time. So we ripen our cucumbers, we ripen ourselves. Om Trambakaya Yajamahe Sugandhim Pushti Vardhanam Urvarukamiva Bandhanan Mrityor Mukshiyamamritat Swaha, you say swaha if you're doing the fire. If not, you don't say it. Thank you all for being here, and I look forward to seeing you next time.